Bismillahirrahmanirrahim. My name is Dr. Shehzad. Today we will discuss about trigger finger. First of all, we discuss what is trigger finger. Trigger finger is a condition in which one of your fingers gets stuck in a bent position. Your finger may bend or straighten with a snap like a trigger being pulled and released. Trigger finger is also known as stenosing tenosynovitis. It occurs when inflammation narrows the space within the sheath that surrounds the tendon in the affected finger. If trigger finger is severe, your finger may become locked in a bent position. And this is the diagrammatic presentation of the trigger finger, and you see the nodule with an arrow. Sign and symptoms of the trigger fingers include finger stiffness, particularly in the morning, a popping or clicking sensation as you move your finger, tenderness or a bump nodule in the palm at the base of the affected finger as shown in the diagram, finger catching or locking in a bent position which suddenly pops straight, and fingers locked in a bent position which you are unable to straighten. Treatment include medications which include NSAIDs, rest, splinting of an affected area, stretching exercises, and steroid injections are used. Some tendon gliding exercises are used as shown in figure, like straight hand, hook fist, full fist, and straight fist. Thank you so much.